co-sponsoring in both houses of the legislature, in the Assembly and the Senate. So if you co-sponsor legislation, chances are you're going to vote yes. You're in a good position to respond to the public pressure from all of us to make good on that promise when you co-sponsored that legislation. So we're in a fantastic position to really make history. In Canada, the way that they got Medicare for all was because one province started it first. That was Saskatchewan. So we are in the best position we have ever been in. And especially right now in the middle of, as we're coming out of this pandemic, as we're seeing how good the state of New York is doing, especially with vaccinating everybody. I know when I went and got my vaccine, I was absolutely amazed at how organized everything was. And it went so smoothly. And that was our public healthcare infrastructure saving our lives. So people are ready to understand how powerful it could be, how free it could be. The rest of the world seems to have all of this figured out. And I think what the vaccines are showing us is that we could do it too. There would be no deductibles, no co-pays, no narrow networks. It's genuinely, so I'm the head of the healthcare committee for Grassroots Action New York, is a chapter of NIPAN. I'm also an assistant professor in health economics at the City University of New York. And I ask my colleagues in health economics all the time, and everyone seems to pretty much agree that Medicare for all gets American healthcare spending under control. I've never seen any other proposal that could do anything like that. It's kind of like the only solution. And the only thing that anybody ever says is, well, politically, how are we going to do it? And the thing about where we're at with the New York Health Act right now is that we have an answer to that. We know exactly how we're going to do it. And in fact, that's what we're going to learn tonight from Ursula. We've got all kinds of events. And the main objective is just bring it to a vote. We've got to make sure that our elected representatives really do their jobs and vote on the bills that we have all pushed and expressed that we need and want, and that we know it's been studied to death. It's going to be great. It's going to work. It's going to save us money. It's going to get us the necessary health care that we all need and want. Now we just got to do it. I'm super excited. So share in the chat where you're from, what it is about single payer and the New York Health Act that you're excited about, what you want to learn about. If you're in NIPAN, which chapter you're in. Where you're calling in from. Just introduce yourself. We'd love to know who is in the call with us. And thank you so much for joining. Oh, also, if you happen to have a marker nearby, later on, we're going to make some signs and hold them up and do selfies and kind of have a "we were here" stamp. So grab a marker before the show starts if you have one nearby. And all right, we've got Felix from LA, who's here to learn about single payer. California, they've been making some moves, but I think that New York's situation at this particular moment is pretty unique, which is super exciting. So let us know in the chat where you're from and what brings you into tonight's meeting. And if you have a healthcare story that you would like to share, about why single payer would be important for you. We know some of the literature and the economics has shown us that with Medicaid expansion, we've seen so many far-reaching consequences, including age-adjusted all-cause mortality reduces. So basically, public health care literally saves lives. And you can find, so many examples in people's lives of how that comes to be. Not just that, but we've found that Medicaid expansion has reduced the rate of home evictions in the United States and reduced the rate of poverty. Because people today choose between medicine and rent. Sometimes they choose medicine and they get evicted. And sometimes they choose their rent and they suffer all kinds of consequences, including death, their own deaths. It's really literally a life and death situation. And what's so amazing is that that we haven't done it yet, I think, when it comes to single payer, given all of the evidence that it's going to save us money, that it's going to get us, our life expectancy in the United States is so far below any of the other countries that are peer nations, even though we spend, at least 1.5 times the next highest spending country. So we know that it's going to bring our costs and our health in line with other countries. And yet we still haven't done it. Absolutely incredible to me. But equally as incredible is the fact that we are truly so close in the state of New York to have majorities in both houses of the legislature co-sponsoring the bill. And, we only have until June 17th to get it to the floor and to get a vote on it. How they're trying to save money in Medicaid these days in the state of New York is by cutting benefits, right? One of the governor's new ideas was that we would have you have to have 2 disabilities to be eligible for personal assistance, not just one. So if you're blind, you're supposed to have somebody who can help you do your laundry and shop for groceries, things like that. It makes sense. This is part of living a dignified life. What they decided now to save money is that you can't just be blind. You must have a second functional limitation. That doesn't make sense. But that's how they're trying to save money instead of taking the profits out and putting the people and our health and well-being in place of profits in what we're maximizing in our organization of healthcare and delivery of healthcare. We can save money by taking out profits instead of taking out the key to living a dignified and healthy life. That's what the New York Health Act represents.
All right, well, thank you everyone for joining our call tonight. My name is Anna Martovich. I'm with Our Revolution. I'm a regional organizer, and tonight I'm here with a wonderful team of local organizers, including Naomi Zevda from Grassroots Action New York, a local chapter of our New York coalition, a NIPAN, New York Progressive Action Network. I'm here with Ursula Rosem, who is with the Campaign for New York Health, and we are going to welcome Assemblywoman Anna Callis to the call, who is going to talk about the New York Health Act and give us a little bit of a legislative update. So it's going to be an action-packed call. I'm so excited to have you all here. While corporate Democrats are focusing on fixing the ACA, we well know that that is not enough and we need to do more. That's why Our Revolution is at the forefront of the fight for Medicare for All. We have endorsed the Medicare for All Act federally, and we have helped get co-sponsors to that bill that Representative Jayapal has introduced a couple of weeks ago. And our latest victory was in Maryland, where we, with Our Revolution Maryland's help, we got Representative Mafume on the bill as the 115th co-sponsor, and I'm happy to announce that today we have our 116th co-sponsor on the federal Medicare for All bill, which is amazing. She has not been on the bill before. Her name is Becky McCollum, and she is joining this bill from Minnesota. So amazing progress on the federal level, but we are not waiting for the federal action. We are taking action on the local level. That's why our chapters have worked tirelessly on passing Medicare for All resolutions locally. Here in my home state of New Jersey, we have passed 8 local Medicare for All resolutions. This is the way that we are pressuring our congressional reps to sign on to the bill. And we have endorsed state single-payer bills, such as CalCare in California and the New York Health Act, which is our topic tonight. So with that being said, I'm happy that we can make an announcement today about endorsing the New York Health Act. Our Revolution is happy to be fully behind this local statewide legislation, and we are going to do everything we can throughout our local chapters in New York to make this legislation happen in this session with all of our grassroots chapters' help and local action. So I'm so excited that we are on this call with you all, and I'm happy to have local organizers on the call who are going to let us know more about what's going on right now and the ways that you can get involved and help the New York Health Act pass in the remaining 4 or 5 weeks that we have left before the legislation session ends. So with that, I am going to welcome Ursula Rosum on the call. She's the co-director of the Campaign for New York Health. Welcome to the call, Ursula.
Thank you. And I'm going to just pass it really quickly to the Assemblywoman before she has to go. Maybe you can stop the slide share. I want to introduce Dr. Anna Kellis, who represents the 125th Assembly District in upstate New York, including Tompkins County and Cortland County. She has a very long and awesome biography, but I'll say I really realized what a badass she is when during the most recent budget fight, she was part of a camp out in front of the governor's office as part of the successful campaign to raise revenues by taxing the super wealthy to fund schools and so many other services in our state. So we're very grateful that she's also a champion for the New York Health Act. So Assemblywoman Kellis, welcome.
Thank you so much. You get to be the official title of badass. I'll take it. I think it's just as good as honorary. So thank you so much for having this. It's really, really, really important to do these events where we're bringing together all of the grassroots efforts. I cannot tell you how much in the last, so I was a county legislator for 5 years. I've been a state assembly member for 4 months. But I was doing activism at the state level with a great organization called Local Progress that also supports the New York Health Act. So I've been in this for years with you all. But I've really seen how the grassroots efforts, I cannot say this enough, actually make or break a bill, make or break a movement. Because, when we hear from our constituents, we are literally seeing, and I can't even count at this point, literally 10 to 12,000 bills a year. And that's in 6 months. There are some bills where people will ask me, wait, how come you're not on this bill? This seems so up your alley. And it's simply because I haven't seen it yet. And I'll add my name to it. And so when constituents reach out to us and they, especially a personal email, and they explain why they're in support of a bill, it elevates it absolutely into, the top 50, which when you're looking at 10,000 bills, that is a massive difference. So my love for this bill started from, very early on. For those who know me, my PhD is in public health. I used to teach public health at Cornell before becoming, and also doing activism, but before doing my political work. So this is very, very near and dear to my heart, both for equity reasons, but also, that is actually the core of everything, the equity component of this. It is so particularly critical right now. It has been highlighted during COVID. I think one of the great arguments that we all can make for this is that COVID highlighted, so everybody can get a test for free, but treatment once you have COVID, you do not have for free, and that has destroyed families. And it is appalling that that was not covered, and everyone would have been covered. You all know at this point the statistics that a third of the people in New York State are on Medicaid, and a significant number of people are underinsured. That is super important. We do not talk about that enough. That would also be addressed by this bill. But another thing that's extremely important, and I think it's important to tell legislators, is that there are so many people who are in jobs almost exclusively because it provides benefits, not because it's good for them mentally, their mental health, not because it's good for their family, not because it's good for where they would like to live geographically, but because exclusively it provides that benefit for the family. What would it be like if we had the freedom to choose the work that we love? How engaged would we be? What would our economy be like if everybody were able to do the job that truly aligned with their expertise, with their passions, with their skills? And that's another thing that we really should point to people on this bill. And I think that's so important. And one of the big barriers that we're facing as legislators, and this is something else to bring up with your representatives, is how this is actually a benefit for unions. we are finding very often in the discussions that there's a roadblock with unions who are scared to support this, who are against this, that believe we've fought for our benefits for so long and we have really good benefits, and we will actually be hurt if the New York Health Act is the main form of healthcare that we all have. And first of all, it's so comprehensive. It does cover long-term health, it covers dental, it covers eye. It is incredibly comprehensive. But the other thing is the opportunity cost that they have spent so much time fighting to have their healthcare benefits. They have not been able to fight as a result for other things like retirement benefits, like salary and wages. There's so many other aspects that they will be freed up to fight for that they haven't been able to because they have been stuck fighting exclusively for their health benefits. That is a huge gain, and that is something that we are struggling with as supporters to try and convince our colleagues. I will say there are a lot of people who are co-sponsors, but don't assume that if your representative is a co-sponsor that they're really actively engaged in making sure that it comes to the floor for a vote. So having co-sponsors is the first step, but getting the bill onto the agenda, that is the key. And that's what we should all be asking for. Let's see it on the Health Committee agenda. If it needs to go to Ways and Means, let's see it get to Ways and Means, and let's see it get to the floor of the legislature for a vote, which it hasn't done in a while. So that is the big push. We have a supermajority in the Senate and the Assembly. We have a supermajority in the Senate and the Assembly. I cannot say this enough. This is an opportunity. This is the year to pass the New York Health Act. There has never been a confluence of issues more important than this year, including the fact that this is the way to come out of COVID. This is the way when we talk about building our economy back, building it back better, and building it back equitably. If we do not have the New York Health Act, we will not reach that. This is, I believe, one of the core components of building back with equity in our community. So I am sort of rallying from the rooftops with everyone. I will be out in the streets with you all. We need that energy. We need your energy. We need your passion. Letters are great, but rallying in the street is even better. Showing up at offices on the outside and meeting your legislator outside, in the middle of COVID, you would be surprised how much it helps. Speaking with your local union chapters and encouraging them to support it. Those are all things that we could all do together. So I'm so glad you're all here. I'm so glad you are all allies. I'm with you in my heart. I'm with you in my energy. I'm with you in my motivation and my work inside. So you guys are the outside game. I will be the inside game with all of the co-sponsors with me. And thank you so much for all of your work and your support.
Thank you so much, Assemblywoman, for making the time to be here. We heard that you are in an extremely long hearing today. So thanks for sneaking away to talk with us. I think that your energy is really infectious and is going to motivate us to keep fighting.
Well, call me anytime if you guys want to pull me back in, and I will join you in the streets. We're right now doing environmental justice, hour 9. So it's the other half of this. But, health is also a super big, important part because, of course, climate change directly affects the health of our communities. So, they're super, super intertwined. So I'll be in both fights with you all.
Thank you. Good luck with the rest of the hearing.
Absolutely. Thank you so much.
So we had some questions come up in the chat about what's it going to take to actually pass the bill, and the Assemblywoman really touched on it. And in Albany, the way things happen is through decisions made by the Assembly Speaker and by the Senate Leader, Andrea Stewart-Cousins. So in just a moment, I'm going to talk about how we are going to be pressuring them. Can you see my screen? Thank you. As the Assemblywoman said, we have to be taking action collectively across the state. And I see that many of you here on this call have been active with the campaign for a long time. And we wouldn't be here at historic majority support in the Assembly and the State Senate without the statewide movement. The Campaign for New York Health was formed in 2014 in order to coordinate all of the activism that existed, but it really blossomed after 2016, and NYPAN really had a huge role in the Campaign for New York Health growing as part of the resistance to the Trump presidency. As Anna Marta said, I'm Ursula Rosem. I'm one of the co-directors for the Campaign for New York Health. I'll just share my brief personal story of how I came to this issue. My family's from Poland, and we used to joke with my friends that Polish people just don't go to the doctor. And it took me a long time to realize that it's not because, we just prefer to use herbs for healthcare, but rather because there was a really deep distrust of the American for-profit health system. And I remember firsthand when I was at the doctor's when I was 15, and the gynecologist recommended a test for a lump in my breast. And my mother said, well, we can't afford that. And besides, American doctors just want to give you tests so that they can make money. And that was extremely shocking that someone that worked long hours, 6 days a week, couldn't afford to pay for a test that the doctor was recommending for their child. So it really hit me at an early age that our healthcare system is profoundly broken. And it's really what motivated me to get involved in political work. So I joined the Campaign for New York Health in 2014 as a super volunteer, like many you are, and joined the staff in 2016. And the Campaign for New York Health was founded by the New York State Nurses Association, and it's really a statewide movement. There's doctors that are in the fight. There's small business owners that are in the fight. We have faith leaders that have added their voice to really bringing attention to why the right to healthcare is a profoundly moral issue. The statewide campaign has hundreds of businesses and organizations endorsing the New York Health Act. The Health Act is founded on these human rights principles, and we believe that they have really been key to helping grow the campaign over the years, because there are so many, as Naomi said, if you talk with economists, well, I guess not all economists, there is so much proof that a healthcare system, the single payer system, is economically more reasonable. However, it hasn't been enough to get the bill across the finish line. And so we've really seen focusing on the human rights principles as a way to grow the statewide coalition. In 2019, the New York Health Act was amended to include coverage for long-term care. And then we saw the coalition grow even more. Groups that had been protesting Assemblymember Godfrey's office and opposing the Health Act came on board as supporters once we included long-term care as a benefit included in the Health Act. And of course, the New York Health Act is also essential to racial justice and health equity, as the Assemblywoman mentioned. Many times when we do presentations on the Health Act and racial justice, we point to the work of Dr. Rhea Boyd, who is a pediatrician and public health advocate in California. That the way racism works is that it fractures and scatters families and communities. And our healthcare system is part of that system that upholds and enables white supremacy in our economy. And so passing the New York Health Act is really critical to transforming our economy to one that is much more equitable and much more caring. And we can really take big leaps towards racial justice by removing the profiteers from the system and simplifying it and making it more efficient. Because passing the New York Health Act, it's not just about redirecting wealth, it's about directing that money directly into care instead of profits. As we mentioned a couple times, we have majority support in the Assembly and the Senate. So on the screen, you see right now we are at 89 out of 49 Assembly members supporting the bill, and 33 out of 62 co-sponsors in the Senate. And really now the key is to move the leadership. Assembly Speaker Carl Heastie and Senate Majority Leader Andrea Stewart-Cousins really are the decision makers in our state house in New York State. And so in the coming weeks, we're going to be directing a lot of pressure at the leadership to bring the bill to a vote. We often get asked, where is the governor on this issue? And we know, as Naomi mentioned earlier, that he's really been pushing austerity for 10 years, and we've seen tremendous cuts to the Medicaid program that we've really had to fight to hold the line and stop the governor's cuts. And we have until June 10th to get the bill to a vote. Many of you know that the Campaign for New York Health strategy has been focused on the power of our stories. We say that movements begin and grow with the telling of untold stories, and that they're very powerful stories for influencing public opinion and influencing decision makers and visibilizing the urgency of why we need to pass universal health care. But ultimately, to win and pass the Health Act, we have to be organized. This is another quote from the National Homeless Union, that we only get what we're organized to take. It's not about having the correct answer. It's really about having the power to make our elected leaders give us what we need. Oops, sorry. So one of the key things that everyone can do, and that you can ask all of your friends and family and networks to do, is contact our state legislators. The call tool, which I think Anna Marta is going to put in the chat, it will send a message to your unique legislators, and it will also send a message to Speaker Heastie and Senate Majority Leader Stewart-Cousins. And so from now until the end of the legislative session, we're asking all organizations to really push this out to your members. We're going to be changing the message up a little bit every week so that you can take action every week and really be reminding leadership in Albany about how urgent this issue is for us. If you'd rather not use the link, you can also text NY Health to 52668. We've talked about the power of stories. If you're on this call and you have a story that you want to share about how the for-profit healthcare system has hurt you or your family or your loved one, you can visit the Campaign for New York Health website, nyhcampaign.org/story. And let us know what happened. And our team can work with you to find ways to share your story in advocacy, whether it's a letter to the editor or a social media video or in a lobby visit. You see in some of these photos, people are holding signs about why they support the Health Act. It's a good time to think about looking for a marker or a pen, because we're going to do a similar action towards the end of this call. One way that we are leveraging statewide support for the Health Act into pressure on lawmakers is every Monday and Thursday, the Campaign for New York Health is hosting mobilization phone banks. And during these phone banks, volunteers, like maybe some of you, I know I saw some of our phone bankers on the call tonight. We're calling New York Health Act supporters and progressives around New York, and we're helping them leave messages for their representatives. It's really fun and satisfying because so many people that we reach are like, yeah, of course, I'll do this. It takes 30 seconds to leave a message for your legislators, and it really has an impact. We hear from the lawmakers that, they're like, oh, these activists are calling my office. So we know that we're getting through. And then on Monday, June 7th, we are going back to Albany. We weren't sure if we were going to go because of COVID, but this is going to be, we're going to do our best to make it COVID safe. It's going to be outside. Everyone is going to be asked to wear masks. We'll have hygiene stations, but please RSVP if you're able to make it to Albany on June 7th. We are going to be calling on lawmakers to use if they haven't done so already, to pass the Health Act before they go home for the summer. The legislative session ends on Thursday, June 10th. So if they haven't passed the Health Act by June 7th, we are going to be there rallying in Albany. And Anna Marta, are you putting the link in the chat for the rally? Cool, thank you. So that is the update about ways to take action together in the coming weeks. And there's other things happening as well. There's lobby visits happening around the state, but we wanted to make sure that all of the actions that we're sharing tonight are things everyone can do and that everyone can share with your networks. So please use the tools that we're sharing to contact your legislators, to volunteer for the phone banks, and to sign up to be in Albany. There on the registration form, you can indicate if you'd like to take a bus, if you're willing to carpool, and if you respond early, it will really help us to plan for the day of action on Monday, June 7th. And so the collective action that we would like to take together before we move on to the next part of the call is to make a selfie in support of the Health Act. We are going to I'm going to stop my screen share. And basically we're going to invite everybody to make a sign, maybe like this one. And we're going to take a picture together. And if you have a marker or a piece of paper nearby, you can make it say whatever you want. You can write something about your healthcare story. You can, I put people over profit past New York Health. Healthcare as a human right is very popular. But we want to show that that we had these great folks on a call tonight together supporting the Health Act. And if you can't find a marker, you can also just turn on your video and we will take a collective photo to show support for the Health Act that we will share out on social media. Oh, and it looks like a lot of you are making the sign. I love to see it. Pass the bill, Jean says. Kevin, yours is a little difficult. How do we have life, liberty, and happiness without healthcare? I have no health insurance. Oh, Leslie, I'm sorry. We're going to win you health insurance for all of us. We got decouple healthcare from employment. All right, let's give you like 30 more seconds. And if anyone doesn't want to if you can't make a sign, but you want to be in a photo in support of the Health Act, you can turn on your video in a second. Pass the bill, Jean says. I agree, pass the bill. Hold on a second here. Okay. All right. What do you think, Anna Marta? Should we take the picture? All right.
Everyone ready? Raise up your sign.
1, 2, 3. Oh yeah, thank you, Felix. Fists up for the Health Act. Awesome. There's a lot of chat activity going on. So I'm curious to see in the chat who is thinking about coming to Albany on June 7th. All right, Rick, we'll see you there.
right, I see a story in the chat. Tanya Morcat said, I stay away from the medical industry, but yet still have horrible stories. One that comes to mind is losing my osteopath who quit Medicare due to the limits placed on his ability to heal. During one injury, he would only see me once a month, which meant every treatment would work, but not hold, as he could not see me with shorter visits to build on the healing. As a consequence, Medicare insured my treatments were so much more beneficial. Another story from years ago concerned being told their diagnosis for a problem which would be based on how much I wanted to pay. I left and never went back, but that put out the money over care very bluntly. So anyone else who wants to share? All right, George is going to Albany, that's great. Leslie is a maybe. All right, everyone, please share your stories in the chat. Happy to share a couple of more. I'm not happy to hear them, but we are happy to share on our national platforms all of your stories, so we raise awareness about the need to pass single-payer universal healthcare, not only in New York, but everywhere in the country. Our revolution, as I said, is making Medicare for all a reality for many reasons. The Affordable Care Act still leaves over 100 million Americans uninsured or underinsured. Many people can't afford, as you well know, to use the insurance they have, such as myself as well, because our co-pays and deductibles are way too high. A recent report found that a third of COVID deaths in the US could have been prevented if we would have had a Medicare for all type system. 2/3 of bankruptcies, as you well know, in the US are tied to medical debt, and medical-related bankruptcies are at an all-time high. Very sad. People of color, as we all know, face disproportionately high rates of uninsurance, and our current system perpetuates systemic racism, as we know. According to a pre-pandemic research, 67% of New York's uninsured population are minorities. And meanwhile, the for-profit insurance companies and healthcare systems are making record-breaking profits. Outrageous. The pandemic, of course, has made it clear that healthcare tied to a job is a bad idea. That's why our revolution is committed to fighting for Medicare for all as the only real solution to our healthcare crisis. And as I said in the beginning, we are doing that at the federal level, but we are also doing that at the hyper-local level, passing local Medicare for all resolutions everywhere in the country, 8 here in New Jersey, and of course, also backing statewide single-payer legislation such as CalCare and the New York Health Act, and helping pass this legislation in New York throughout our grassroots network under the NIPAN coalition. All right, so that was our call. I'm happy to let you know that we have a New York call coming up. May 27th is going to be our big endorsement rollout call. I'll put the link for that in the chat for you, so you can all join. We have a lot of exciting candidates that we are going to back all throughout New York City, and we are expecting your help for that. Hopefully you'll get behind get out the vote efforts for these candidates. As I said, I'm going to put the link in the chat for you. And every Monday, we also have an exciting national field call that comes together Monday night with progressives from all across the country, with our progressive champions in Congress, but also local organizers who are doing extremely important work all across the country, with state networks that are invested in transforming the party, in pushing progressive legislation at the local level. These are exciting calls. We are working on the Monday night call, but usually we have a super exciting headliner. So that is going to be in the chat for you as well. And with that, I want to thank everyone for being here tonight. Keep working on passing the New York Health Act, and tune in for our Monday night call and tune in for our endorsement call on the 27th. The link is in the chat for you now. Happy to have you here. This was a great turnout, a very informative call. Thank you, Ursula, and thank you, Assemblywoman Callis. Thank you to our local network and NIPAN representatives from all across New York who were here on the call, George and Naomi and everyone else. We are looking forward to seeing you on Monday night and also seeing you on the 27th for the New York endorsement rollout call. We usually close our calls with a big chant. So unmute your microphone if you can. If not, I'll try to do that right now. And we can chant our usual chant, which is when we organize, we win. I'll try to find that option to unmute your microphone if I can. But if not, let's do it with Ursula and Naomi and maybe Kara. When we organize, we win. When we organize, we win. All right, see you on Monday and on the 27th. And thank you, Ursula. Go New York Health. Woo.